discretion advised may contain disturbing and graphic images. Watch with caution. Ben Carson, a young, intelligent, well-known neurosurgeon, created a well-known medical frontier in 1987. He was given a case that would forever change his life and the Binder family's life. He was given the task to separate 7-month-old twins Benjamin and Patrick Binder. He was able to separate the twins through an operation called a hemispherectomy, a surgery where half of the brain is disconnected, removed, operated on, and then reconnected, one becoming two. On September 2, 1987, Ben Carson, a neurosurgeon at Johns Hopkins Hospital, performed the first ever successful hemispherectomy, a surgery where part of the brain is removed on conjoined twins, 7-month-old Patrick and Benjamin Binder. This medical frontier, led by Dr. Carson, created a more reliable way of performing the separation of craniopagus, conjoined at the cranium, twins, and forever changing the lives of many. This medical frontier leads to the theme Frontiers in History, People, Places, and Ideas, because before Carson, there have been many unsuccessful attempts to separate this rare medical condition that were considered unsafe and unreliable. Dr. Ben Carson came up with the idea to perform a hemispherectomy, an operation where half the brain is removed on the twins. After completing the surgery, he was then able to perform multiple of these operations on other conjoined twins like the Binder twins. This created a more reliable way of performing the surgery that then could go on to change the lives of not just the twins, but their families as well. It gave them the chance to live the most typical life they could. This medical frontier allowed the twins to be able to walk, crawl, and turn over on their own, which would not have been possible before the surgery. Since then, he was able to give other twins the same opportunity, forever changing their lives. The first record attempt to separate conjoined twins was in 1690, which was unsuccessful. From then, there was 26 more unsuccessful attempts to separate conjoined twins. Ben Carson was a troubled child who struggled in school and with his temper. With the help of his mother and his teacher, he was able to overcome this and began to succeed in school. He soon graduated high school at the top of his class and got a scholarship to Yale University, where he majored in psychology. After graduating college, he began his journey to becoming a doctor at Johns Hopkins Hospital. At the age of 33, he became the youngest chief of pediatric neurosurgery. At the beginning of his career, he focused on pediatric tumors and brain reconstruction, but then began to specialize in conjoined twins. He was first presented with the case of the Binder twins in 1987. In Ulm, Germany, on February 2, 1987, Joseph and Teresa had Patrick and Benjamin Binder. They weighed 8 pounds and 14 ounces combined. Doctors told Teresa and Joseph their sons would have no chance of walking, crawling, and turning over on their own. Teresa's first reaction to the twins was, "My God, what will they look like and how will they live?" which she reported to the Washington Post. 7 months after their birth, their case reached Carson in Baltimore, Maryland. Hesitant at first at taking their case, knowing how difficult it was going to be to separate the twins without the death of one or permanent brain damage, and at the time it was considered impossible. He strategized for weeks trying to find a possible way of successfully separating them. Months after strategizing, medical frontier Dr. Carson was able to find a way to separate the twins that would keep them both twins alive and not give them permanent brain damage. A team of over 25 surgeons and nurses began rehearsing the hemispherectomy. Luckily, the twins did not share the same brain and had 2 separate brains. They practiced on dolls joined together by Velcro for months to prepare for the surgery. After months of preparation, Benjamin and Patrick went in for surgery on Labor Day, September 2, 1987. News outlets gathered around the hospital to get photographs of these rare twins or to get an interview with Dr. Carson and his team. The twins went back for their life-changing surgery. After lots of preparation, the surgery began. For the first 4 hours of the operation, surgeons specializing in the heart went in with hair-thin tubes in their veins, then connected them to heart and lung machines that would keep them breathing throughout the surgery. The scalpel was then passed on to the 5 plastic surgeons to slice through the tissue in their scalp to remove the bone tissue that was connecting them. Cardiologists cut openly on their chest to remove small amounts of their tissue from their heart to later be used to reconstruct the veins. Before making the big cut, the twins' heart rate was then dropped to 68 degrees so they could continue to operate without blood flow. This was an unheard of technique of separating conjoined twins. The pressure was on. A large clock hung up on the wall counting down the hour they had to perform the procedure. If they proceeded the time limit, it would cause permanent damage or death to one of the twins. In Carson's book, Gift to Hands, he states, when the hour is up, just turn the pumps back on. If they bleed to death, they'll have to bleed to death. But we'll know we did the best we could. It was then Carson's turn to perform this life-changing surgery. He severed the primary vein that connected the twins. Using the tissue that had previously been taken, they began to make the new veins in both brains. Both twins were separated. One finished in 57 minutes and the other in 63 minutes. For the first time in history, conjoined twins were separated. Both twins were put in a medically induced coma due to the impact of the surgery. Once separated, the twins began to go into recovery at Johns Hopkins Hospital. This was the first time conjoined twins had been successfully separated. It was also the first time it was attempted to separate craniopagus twins through a hemispherectomy. They immediately already had a better chance of surviving after being separated. After this medical frontier occurred, the twins had woken up and were no longer under stress, which they were in their medically induced comas for around 3 weeks. They began physical therapy to begin crawling and moving on their own. 7 months later, the twins went back home to Germany. They were left with permanent scarring on their scalp, leaving it not possible for them to grow hair where the incision was made. For the next few years, there was not much known about the twins. Ben Carson wrote letters and tried to reach out. He did not receive anything back. Carson continued to stay in the media. He was interviewed by many news outlets. He then wrote his book, Gift to Hands, and had a movie made about him, Gift to Hands, the Ben Carson story. He continued his career as a neurosurgeon and went on to separate other sets of conjoined twins, like the Binder twins. He was able to separate 5 more sets of conjoined twins. This medical frontier is significant long-term because if there is ever other case of other conjoined twins, then their parents would have hope for them surviving. Carson performed this surgery. Other doctors went on to perform the same surgery on similar cases. A more reliable way for twins to be separated. It gave them a higher chance for the twins to be able to live a typical life and have a better chance of surviving. Joined twins can now go on to live their own lives, get their own jobs, and significant others. This medical frontier inspired future generations of doctors to perform this same method of surgery on other sets of conjoined twins. This medical frontier inspired others to take risks. Carson states in this interview, when performing his surgery, he wants to inspire others to take risk, because without risk, there's no success.
The vast majority of people really never accomplish anything in life because they're afraid to take risk. There's another group of people who never accomplish anything because they take too many of the wrong risks, and they are always getting knocked back into the pond. So learning how to analyze them appropriately. And one of the things that I emphasize here is learn to ask the right questions. You know, if you're getting ready to do something, say, what is the best thing that happens if I do this? What's the worst thing that happens if I do it? What's the best thing that happens if I don't do it? What's the worst thing that happens if I don't do it?
Most importantly, this frontier changed the lives of current and past conjoined twins and their families, giving them a more reliable and safe way of being separate, forever changing their lives. Ben Carson's separation of craniopagus twins through a hemispherectomy on September 2nd, 1987 at Johns Hopkins Hospital created a more reliable and safe way of separating conjoined twins. It forever changed and will go on to change the life of the families of the conjoined twins. This surgery was considered impossible to perform, and Ben Carson was able to perform a method of surgery that will change many lives. This medical frontier will go on to safely separate twins and give them a normal life without giving them severe damage. Ben Carson changed the Binder twins' life, turning one into two.